Alright, healthcare professionals, let's dive deep into how ethambutol battles TB. Ethambutol hydrochloride is a fascinating compound. Water-soluble and heat-stable, it packs quite a punch against tuberculosis. So, what's the magic behind its mechanism of action? Ethambutol inhibits arabinosyl-transferase 3. What does that mean? It disrupts the transfer of arabinose into arabinogalactan biosynthesis, which essentially throws a wrench into mycobacterial cell wall assembly. Now let's talk pharmacokinetics. Ethambutol has an oral bioavailability of around 80%, and 10 to 40% of it binds to plasma proteins. Interestingly, about 80% of the drug remains unmetabolized and is excreted renally. Therapeutically, it's used for treating TB, disseminated MAC, and M. kansasii infections. The standard dose is 20 milligrams per kilogram per day for adults and children. However, in patients with renal failure, the dosage adjusts to 15 to 25 milligrams per kilogram 3 times a week, even for those on hemodialysis. But like any medication, ethambutol has its share of adverse reactions. Serious ones include optic neuritis. Others can be rashes, drug fever, joint pain, GI upset, confusion, headache, and dizziness. To mitigate risks, tests for visual acuity and red-green discrimination should be done prior to starting therapy and periodically thereafter. That's a wrap on how ethambutol tackles TB. Stay informed and keep those patients safe. Thanks for watching.